Tajman Singh is mobilizing and dispatching volunteer healthcare workers to hospitals across India to stop COVID-19 from spreading.
The demand is very high and we are not able to fulfill all the demand of setting up and running isolation center because of shortage of manpower, material, and of course other resources.
Dr. Singh is the founder of the India-based humanitarian organization, Doctors for You, that he runs out of the charitable hospital, Vistex.
In many places, our doctors are not able to join because there is no train services.
In New Delhi, where Dr. Harjeet Singh Bhatti is on the front lines, he's taking extra precautions of living apart from his family in Punjab.
My mother is now there and I am working here, and she is otherwise an elderly and also suffering from cancer. I have to see 55 patients in a day, and my hospital have a capacity of 100 patients.
The fear of exposing family to the virus is also keeping Dr. Mohammed Hakim and his neurologist father from commuting from home in Tamil Nadu.
I miss my family and I'm worried about my family because of me, I'm getting exposure from a COVID patient.
To help hearing impaired patients, Dr. Hakim used his own funds to help produce a transparent mask with his friend.
When I wear and I talk with a hearing impaired patient, he can visibly see my lips and he can understood. So the language communication can happen very easily.
Dr. Joyita Basu has a private practice in Gurgaon, Haryana. She said she's working longer hours and making sure patients receive the attention and care they need.
We are seeing a lot of COVID patients, and plus my regular patients, all my other patients who are there, who have their diabetes, who have their blood pressures, who have some infections. We are seeing a lot of typhoid these days. Dengue started because the rainy seasons are here, so dengue has started.
Dr. Roshan Radhakrishnan in Kerala said he's now working on a reduced salary and noticed more and more patients defer their elective surgeries for fear of contracting the virus.
It is frankly, demoralizing when you're working the worst pandemic of your life and you're told that this is the time when you're going to have to take a pay cut.
India is in the top 3 countries with a surge of coronavirus cases. Experts like Professor Vish Vishwanath also point to population size and density as major challenges in minimizing the exposure.
It is a mixed picture there. They were very successful in taking early action. As soon as they discovered the problem, you can keep a billion people, a nation of billion people, under lockdown only for so much time.
This pandemic is very severe and it's our responsibility to fight the pandemic.
What I'm seeing really, really disturbs me, but this is the job that I have and I love my job, and it's us against the virus.
Never-ending shifts, machines constantly buzzing, and patients dying every single day. Doctors across the country are still fighting this virus, and they're asking the rest of us to do our part to help. Here's what it's like on the front lines right now.
It's been a very rough 48 hours in Dallas County. We lost 30 lives, 30 citizens of our county yesterday to COVID-19.
Florida, we're used to hurricanes, right? So you get the warning, the hurricane's going to hit, the hurricane hits, and then you have the aftermath. But a hurricane tends to be sort of a finite amount of time, and this is infinite. And so you don't have this knowledge of an aftermath when you have no idea how long the hurricane is lasting. So that definitely makes the day-to-day difficult as healthcare workers, is not knowing when is the end.
There's that stress, there's that strain, there's a strain in the world around us. There's the conscious and subconscious concern that we have of going home at the end of our workday and hoping and praying that we're not taking the virus home to our loved ones. But then there's also the sensory onslaught There's the beeping of the pumps. There is the rumbling, constant noise of air circulation machines. And all of that together is just an environment that when you get off the elevator doors and you enter our ICU, it's it hits you. It's palpable, it's audible. It's a completely different setting than we've had in the past. Every day is a new day. We are unable to kind of predict what tomorrow or next week will be. And so I think a lot of us are just in the moment and keeping our heads above water in that moment. Our only ask is help. Our only ask is support. And when I say support, we don't need TV commercials. We don't need hero accolades. We don't even need banging of pots outside the window at the same time every night. All we need is for everybody to just wear that mask when it's outside of the home.
Florida reported 186 coronavirus deaths today. That is a single-day record for the state. It is also, though, the third day in a row with fewer than 10,000 new cases there. And what about the baseball situation in Miami? The MLB is putting the Marlins season on hold through Sunday after several players and coaches tested positive for the coronavirus. NBC News correspondent Sam Brock is outside Marlins Park in Miami. Sam, the Yankees and Phillies series postponed as well because Philly is the last place the Marlins played. What's the latest from the team there in Miami? What's going on?
The latest, Allison, is there was deep concern this would affect not just the Miami Marlins, but potentially all of Major League Baseball. When we sort of interfaced with the Marlins earlier, we found out that they were, in fact, pausing Major League Baseball was the rest of these games, and we weren't sure exactly what the league was going to say. Then we found out it was going to be the rest of the Marlins games through Sunday and the rest, as you said, of the Phillies-Yankees games. But there was concern at one point this could be a league-wide stoppage. And the reason that I say that is because Rob Manfred, who is the commissioner of Major League Baseball, had already said if one team cannot field enough players where they become competitive or lack of that ability, that would be a threshold for stoppage or changing plans. It appears that's happened, but what they're doing right now is buying the Marlins some time. The latest right now, Allison, this is kind of surprising. If you take out the Miami Marlins, no other team in Major League Baseball has had a positive test since Friday. This is exclusive to the Marlins. Wow. They have 4 more that were reported today, which gets you up to 15. That is about half of the team's traveling roster has contracted COVID-19. So they're out of it. What Major League Baseball does not want to do right now is to see this obviously jump to any other teams. Can they isolate the situation here and allow other teams to continue playing and then get the Marlins back in 4 or 5 days? That's the goal. Clearly, Major League Baseball is not throwing anything in for the season yet, but there has to be great trepidation right now, knowing how fragile the situation is.
Oh, Sam, it's incredible to hear those numbers on just one team. Really unbelievable. All right, let's talk about what's going on in Florida more broadly right now. Nearly 600 people hospitalized there in the last 24 hours. What's going on with the state's coronavirus curve right now?
Right. When it comes to hospitalizations, I think it would be fair at this point to say that Florida has plateaued. They peaked at about 9,400 COVID-19 patients. That was about a week ago. Right now, they're just over 9,000 at 9,011. That's the latest figures that we have. It's gone up, it's come down, it's gone up a little bit in recent days, but it's plateaued. In Miami-Dade, we peaked at 2,300 COVID patients. We're now below 2,100. So you're seeing the right trend lines there. The positivity rates are always that sort of word and metric that you look at because you want to know how widely this is being transmitted in the community. Still at about 15% for the state. If you take out the percentage of people who had already tested positive, more like 11%, that's down several percentage points from where we were a week ago at this time. So these are all good signs, Allison. But still, you mentioned the fatalities. 186 was the latest reported number. That's more than 6,100 for the state. That is a staggeringly large number. But it also does not mean that this all happened in the last 24 hours. The governor himself has already said that when you're looking at the death totals per day, sometimes they're collecting deaths that came weeks or several weeks prior. So it's not necessarily a snapshot of what's going on right now. We do know in its totality, it's a very humbling figure.
Sam, we know the governor had a briefing today as well. What else did he have to say?
He talked about the fact that he feels like in the next couple of weeks, Florida is going to be in a much better place than it is right now. and that is entirely possible. He also discussed trying to get more shipments of remdesivir, which is a drug that helps people who are struggling right now with COVID-19. The state had shortages. He's bringing more of that in. All of this is true, but 15% as a state positivity rate is exceptionally high. So what they're hoping right now is that the numbers that are plateauing are going to continue to improve. But you still have shortages right now of healthcare workers, Allison, which is a severe problem. You still have extremely flammable community-wide transmission at this moment. And so until that ceases, we're not plateauing, but actually going down. I don't think anyone is waving a victory flag at the moment.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.